Hi, I'm Dr. Neal Anzai. I'm the medical director of the eating disorder programs at Ontario Shores. So the first thing you need to know is that there are multiple different types of eating disorders. Here we primarily treat anorexia nervosa, which is a very disabling illness that can affect not just patients, but families and friends, and it's quite overwhelming. There's a lot of misinformation about anorexia, but it's not something people do to get attention. Usually the story you get is that kids try to be healthier, or maybe during the pandemic when they couldn't exercise, they were just trying to optimize their health. But then for some kids, it gets to the point where then it becomes obsessive. It becomes the force that organizes their whole life, and they have to just eat less, lose more weight, and they lose all perspective on that. So that after a while, the desire to lose weight, the obsession with that, gets to be so overwhelming that they get to the point where they become medically ill. In addition, the starvation causes them not to be able to think clearly. And so the way they think changes, their personality changes, they withdraw, they get more anxious, more depressed, and pretty soon the whole family's trying to help, but nothing they do seems to help. Unfortunately, during the pandemic, it's also true that a lot of centers for eating disorders had long wait lists, sometimes 1 or 2 years. And after 1 or 2 years of having an eating disorder, then it becomes entrenched. It becomes part of your identity. And it's really hard for these kids. Even if they want to get better, it's too scary to get better. They're afraid of gaining any weight. They're afraid of eating anymore for fear that it's going to get out of control. They start to see their body differently. So even though we might think they look horribly ill, they think they're fat or that one part of their body is too much. And then treatment has to be very intensive to get them out of that. Oftentimes we get patients who've been in medical hospitals because they were medically unstable 1, 2, 3, 12 times, or been in psychiatric hospitals multiple times as well, so that here we have to employ very intensive treatment. So we do all kinds of things. It's not just being medically stable. It's getting them to learn how to eat normally and maintain that. It's teaching the parents how to help them with that. But then it's also getting them through this process of gaining the weight without panicking and then stopping their eating again. And then unfortunately, because most of these kids, they're vulnerable to it partly because they don't have a good sense of who they are. Their self-esteem is not very good. So we have to work on that so that they can feel good about themselves, so they won't want to hold on to the eating disorder, which for a while helped them feel in control of their life. But then they got so impaired, they didn't realize that their life was now out of control and they can't stop. So that's a very complicated process, and we do a lot of things to help with that. So we have 2 programs here at Ontario Shores. One is an inpatient live-in unit where patients who failed treatment elsewhere have to come here, and we can apply a lot of different treatments to help people with anorexia. Unfortunately, some of these kids also have developed other kinds of problems, so we have to deal with that too, as well as all the standard things we do to help the kids learn how to eat, how to tolerate the changes in their bodies, help their families learn how to support them, and then focus on the more positive things in their life so that they have a reason to want to get better. So on the eating disorder unit, or EDU, which we call it, we can take up to 12 kids, and then they live here for a few months as we go through all of this. And then we have to work with the referral source so we can transfer these kids back to outpatient treatment, and they will continue to do well. So far, we've gotten a very good response from the kids, and the majority of kids do so much better when they leave, and they're grateful, and their parents are grateful as well, and they do much better in outpatient treatment after that. Our second level of care is day treatment. So it's the eating disorder day treatment program. Now that is designed to be a step below having to come into the hospital, but a step above just straight outpatient treatment. So that means the kids who are struggling with their eating disorder and can't quite make it, we're trying to treat them so they won't have to end up in the hospital. Although they might have been in the medical hospital because they weren't stable, But as an outpatient, it's a little bit easier because then they don't have to live in the hospital. They can still have parts of their life still there, but most of the kids, when the anorexia takes hold of them, they're not able to lead a normal life. So we're still having to do the same kinds of things, helping them understand how the eating disorder affected them, helping them understand why you need to eat, why you need to gain some weight, but also reassuring them we're going to control the amount of weight you gain so you don't get out of control, you don't get overweight. But because they have this body image distortion that makes them feel fat, no matter what weight they're at, we have to help them gradually correct those distortions. And that's a very complicated process. We do a lot of different types of individual therapy. We have a dietitian full-time who's coaching them on how they're supposed to eat, explaining what they're eating and why. We have therapists who are working with the family. We have multi-family therapy groups where several families will come in, share their experiences, get support, and learn together how to better support your child so that when they leave the program, they're able to function now in an outpatient setting and continue their path towards full recovery.